Hi, my name is Chana, and today I'm going to be presenting about the topic, It is just diabetes. Should I be worried? This would be presented to a group of my peers. Whilst there are two main types of diabetes mellitus, I'm going to be focusing on type 1 diabetes mellitus during my presentation. So, let's talk pathophysiology. According to Lucia and Weinstock, type 1 diabetes mellitus is a chronic autoimmune disease which is caused by the immune system destroying the insulin-producing beta cells in the pancreas. This results in the pancreas producing no insulin, a hormone crucial for regulating blood glucose levels. Since the beta cells are destroyed, insulin cannot allow glucose to enter the body's cells, which means the body isn't receiving the energy it needs. This gives rise to a glucose buildup in the blood, leading to high blood sugar levels or hyperglycemia. This image over here is a very simple way for us to understand type 1 diabetes. Below the definition, we can see a flowchart. The flowchart is simply saying that since the pancreas isn't producing insulin, which takes us to a downward pointing arrow indicating low insulin levels, this leads to elevated glucose. Let's move on to discuss physical impacts on an individual's. Type 1 diabetes certainly impacts one's physical health and can often lead to different long-term complications. Some of the most common diabetic complications are diabetic retinopathy and neuropathy. Diabetic retinopathy, as reported by Chana et al., is caused by specific damage to the blood vessel in the body that correlates with the retina. The retina is a thin layer of tissue at the back of the eye that senses light and sends visual signals to the brain. Think about it like a camera. It works to capture images so we can see. Imagine, since diabetic retinopathy causes damage to the retina, one's vision would become tainted, or the camera we compared it to would be working incorrectly. In accordance with Cheng et al., we can infer that within the diabetic population, the most common ocular fundus disease is diabetic retinopathy. An observational study conducted by Yin et al. Determined that 40% of the diabetics participating in the study suffered from some form of diabetic retinopathy. The other complication we mentioned earlier was diabetic neuropathy, which is described by Strand et al. They outline the complication as resulting from prolonged untreated hyperglycemia, which then causes nerve damage. This nerve damage leads to numbness, pain, muscle weakness, and potentially foot ulcers. These foot ulcers can be of great concern, being that a person with diabetic neuropathy may be experiencing loss of sensation in their feet. They're at a higher risk of developing foot ulcers as a result. According to Armstrong et al., about 50% of diabetic foot ulcers become infected, which can then lead to gangrene and worse, limb loss. Seeing such large percentages of complications because of type 1 diabetes really illustrates the vast physical effects diabetes has on people's health. Thinking back to our original question, it is diabetes, and I do agree that yes, you should be worried. In saying that, although type 1 diabetes certainly is a chronic condition, there are so many new technologies that can help a person experiencing diabetes to manage their symptoms. According to the research from Stone and Bailey, we can see the positive impact of devices such as continuous glucose monitors, or CGMs. Not only does a CGM help you to be on top of your glucose levels, but since the CGMs have been programmed to trigger an alert when your glucose levels are rising or plummeting, they're effectively helping you stay away from severe hyper or hypoglycemic emergencies. With such a current range of options of CGMs, people living with type 1 diabetes can not only survive, but they can thrive. Dexcom and Medtronic are just a couple of brands of GCMs that have become life-changing for those living with type 1 diabetes. As reported by Diabetes Australia, there are some people who do still choose to manually take BGLs and administer insulin via injection. I want to end off by looking at the long-term repercussions. How could diabetes challenge a person's future, and are there potential opportunities for improving health outcomes? In terms of social impact on an individual, according to AT2 et al., we can determine that diabetes stigma has a major impact on those living with type 1 diabetes. It's heartbreaking that people should experience negative attitudes, prejudice, or stereotyping about a disease they did not choose to get. Findings from Geza et al. Detail the concept of diabetes stigma and the unfortunate reality of 80% of people with diabetes experiencing it. Diabetes stigma can challenge a person's future as it may lessen their desire to go out and do even simple chores like shopping due to increased anxiety. On another note, when looking at opportunities, Greg et al. Sheds light on a World Health Organization initiative called the Global Diabetes Compact. The goal of this initiative is to reduce diabetes risk and ensure that people living with diabetes have access to affordable care and prevention.